So, my dear students, please be careful. Read the words carefully. It is ITP chronic. The previous class was acute ITP and this is chronic ITP. They can be asked as a single essay or two different questions and you should answer them correct. I had already explained you people that there is a tangled mass of fibrin in which the RBCs and the other cells get caught, which is called a thrombus. If the same thing happens outside a blood vessel, it is a clot. That we shall see in a different class. Next one can be the antibody producing cells. They become activated. As a result of which you find chronic ITP. This is another one and I'm continuing along with it. There are two things. One, there can be a persistent ITP which can go in for a resolution. It can be because of environmental insult. So remember one, environmental insult. So these are the plasma cells producing the antibodies and they get formed and onto the lymph nodes, bone marrow, etc., where they cause a destruction. And also you find that there can be antibodies produced by the T cells and the NK cells. All of them lead to this is a megakaryocyte, destruction of the megakaryocytes and the platelets, leading to chronic or severe ITP. Please do remember this. Environmental insult, antibody producing cells, then the plasma cells being activated, and then peripheral killing. Chronic ITP, I have told you, duration is more than 6 months, adults are affected, and there can be a preceding viral infection, which is not there in this case. There can be bleeding in the form of petechia or ecchymosis. Intracranial can also be there. The peripheral blood will be showing decrease in the amount of platelets, as I had mentioned over here. The bone marrow, normocellular megakaryopoiesis alone will be normal or increased in number. And there is a basophilic cytoplasm with vacuolization. Look for platelet antibodies and the bleeding time is prolonged. The other conditions where ITP are or changes will be the urinary tract, skin, mucous membrane, subarachnoid space. The differential diagnosis, the tabular column that I had shown, you people shall and will by heart. So kindly memorize this one. So peak incidence 2 to 6. Chronic, it is in older age. Sex predilection nil. Whereas here it is 3 to 1, female is to male. Viral infection common in ITP, acute, whereas it is unusual. Bleeding is abrupt, it is insidious. Count can be as low as less than 20,000. Here is 30,000 to 80,000 per microliter. Eosinophilia and other lymphocytosis can be common because it is immunological. Duration, self-limited. It can be for a long duration, for months and years. Remission is spontaneous, it is uncommon. Kindly memorize this particular tabular column. Thank you for your patient listening. Remember, these are all important university questions.